is Michel Boivin. Sorry, I should say I'm Jenny Jenkins, and I'm chair of the Atkinson Centre at the University of Toronto. Thank you all for being here. We're delighted to see you all. And I'm really pleased to introduce my friend and colleague, Michel Boivin, and he's going to talk to us about how can research in child development inform early childhood policy and practice. But let me just mention a few things about Michel. He holds a Canada Research Chair in Children's Socio-Emotional Development at Laval University. He's a leading scientist worldwide on the biological and social factors that influence socio-emotional and cognitive development in kids. He runs several a lot of the work that Michel has done comes from several large longitudinal studies of singletons and twin studies in Quebec, and he's followed up children for years and years. So a lot of what we know about early development from Michel and from Quebec comes from these wonderful longitudinal studies that he has contributed to, where he's looked at both environmental and genetic influences. He's also, I think, been a great citizen in the early childhood community, both domestically and internationally, and getting us all linked up and trying to join forces, putting our knowledge and efforts together to make the world better for young children. So he's interested in the range of policy actions that will really support early development. So it's my pleasure to hand over to him.
Thank you, Jenny. So my first words are for the organizing committee, Kerry McQuaid et al., for having invited me. So it's really a pleasure to be here. Although it's a bit hot for me, I'm from Quebec City, so I'm not used to that hot weather. So I'll try to get by. Let me start by, just, this is the animal. How do I get that moving? No?
Is it working for you? No.
It's not working? Which? Okay, it's working. I'll just activate this one. Okay. Sorry about that. So let me just start by throwing at you the more complicated slide of my presentation. Just to set the stage, as Jenny told you, I'm a developmental psychologist. I'm a child development specialist in a way. So I'm interested in individual development and understanding development lifetime, but starting very early, obviously. So this is what I'm trying to do with my team and at the center I worked at GRIP. But also I think it reflects what the field is trying to do, to understand development, starting by addressing the issue of individual trajectories, defined longitudinally. So the way we work, we use large-scale longitudinal study to trace the individual trajectories, to see how these individual trajectories that we trace from very early on predict to all kinds of very nice outcomes. We're interested in problems, so we like to predict what the risk factors that predicts to these depression, anxiety problems later on in life. And we do it within a framework of gene-environment interactions. So we're interested in explaining these individual trajectories by the combination of gene and environment, the interplay of gene and environment. And then, of course, we're interested in the environment, and we assess the environment in a variety of ways, from what we call more distal variables, typical of socio-demographic factors, SES, neighborhood, school, those kinds of factors, but also looking at more environmental factors that are more proximal to the child, parents and the peers. And of course, we're interested in mediating mechanisms involving brain mechanism. So that's the general picture of what we want to do, try to do. But today I'll be focusing more on individual trajectories, looking at the power of a longitudinal study to inform policy in a variety of ways. So individual trajectories that can be traced back to very early development. There's been a substantial number of new studies in the last 15 years. These new studies are new in the sense that they start earlier. The new study that we're now planning start in the fetal period during pregnancy. These new studies are characterized by detailed assessment of the first 0 to 5 period, and they also are very informative in terms of biological processes. So we collect a bunch of information of various kinds concerning the biological processes. So my talk today will be organized around these questions. My point is that longitudinal study can inform human development policies and practices in a variety of ways. First, by documenting developmental trajectories, how early they start and what are their form, by trying to understand predictive or describe predictive associations between these early trajectories and social capital issues later on in life, but also in explaining, understanding developmental cascades and processes. So by doing this, we can point to important periods of changes and possible targets for intervention, which speaks to the importance, which can be very relevant for policy practices. But also in some cases, when we have the information embedded in the longitudinal study, we can also document the impact of ECD programs and policies. And that points to, when we do, we get information that can be highly relevant to orient policy. So I'll be talking about this in the middle of my talk and conclude with a few words about the implication of these findings for the programming of policies. That's Jenny has alluded to this. We have a couple of cohorts that were initiated in the mid-1990s that we're still following. I'll be speaking mostly about the LDEC. I won't be talking about the twin study. If only to say right now that the twin study is a tool to assess genetic factors indirectly. And when we do this, we do find very important genetic influences on individual development. But we're interested in examining, there's always a very strong environmental components, and also we need to think in terms of gene-environment interplay. So for the purpose of our discussion, it's important just to know that this combination of gene and environment creates a lot of variability. So in children development. So this is something to be understood if we want to eventually adapt the interventions for particular child. So I'll be describing mostly results from the LDEC study. This was initiated in 1998. It's a sample selected to be representative of children born in 1998 in Quebec. It's not a big study. It's a study that is actually run by the Institute of Statistics in Quebec. The original sample was about 2,000. We're down to 1,500. We're still following them. They're into adulthood right now. What is very unique, I would say, about this study is the fact that we have 6 data points before school entry, which really puts this study apart from other kind of studies internationally. So it's really about the early development which makes this study rich. And of course, I'll be speaking to this today. Let me start by simply giving you some results that we got from describing trajectories. Because we had those data points, we were able to assess behavior problems longitudinally, starting at 18 months. And from that information, repeated information, essentially based on mother ratings, we are in a position to look at possible clusters of kids that follow the same trajectory over time. And what's striking when we do this we did that for physical aggression, hyperactivity, anxiety and depression, and separation anxiety. Separation anxiety is a bit different, but I'll go back to this later. If you look at the first three components, there's really something similar in these figures. The dynamic of development is different. They will develop at different pace. For instance, anxiety and depression, the trend is much steeper than for physical aggression or for hyperactivity, where you have a very stable line. But what is typical is that starting very early, as soon as we can measure it, you see individual differences emerging. So trajectories of emotional and behavioral difficulties are really established very early in life. So that speaks to the importance, of course, of possibly intervening earlier. There's also always a group of kids who show more of these problems over time. And the last point I want to make is that at least for these three types of trajectories, three behavioral categories, they don't crisscross. I mean, if you look at the trajectory seems to be established very early. You don't have kids starting early, starting high and then going down, being aggressive and not being aggressive after a certain time. So it's really the fact that these trajectories are established very early. Separation anxiety is a bit different. For this behavior, you have this first category of kids where if you assess them at 5 months, they tend to show high anxiety similarly, but then you have these two trajectories that get separated. That speaks to the importance of adding a longitudinal approach to assessing trajectories, because you see these two kinds of kids should not be confounded in terms of their development. So that's one point. We can assess trajectories, and then when we have the trajectories, we can look at the predictors or risk factors associated with these trajectories, high trajectories of aggression, for instance. And the other point I want to make is that when we look at these predictors, there's not only one standing out. There's a bunch of factors that uniquely predict to being high on physical aggression in this case. You have a combination of child characteristics, mother characteristics, and family characteristics. So there's no single predictor. So this is something to really remember when we speak of intervention. There's a collection of risk factors. You cannot summarize the problems by focusing on one single risk factor. There are multiple risk factors reflecting adversity to any trajectory. So that's important, I think, for policy planning. When we have those longitudinal studies, we can also assess not only child characteristics, but characteristics of their environment. And when we do, we get interesting information. In this case, we've assessed interpersonal difficulties, whether the child was victimized and bullied, according to mother again. But if you look, then you see the same type of pattern, the type of environment to which a child, or type of experience to which a child is exposed, varies. You have a small group of children, about 4%, but still 60% of boys who are exposed to negative peer experiences very early in life, so before school. So again, these situations get established way before school entry, which militates for the value of intervening early. And when you look at these trajectories, you can, of experience, you can also try to understand what predicts those trajectories, and that's what we did. And physical aggression was one child factor, but there was also other factors that had to do with the family and to the parenting, to the parent. So there's, again, it's not a simple equation, it's a complex equation. And we start understanding the type of process that may be happening. And this is, of course, is predictive of what comes out later. You can go a step further, provided you plan to collect the good information and try to understand the developmental processes that explains the development of adjustment, or in this case, school readiness. This slide shows the association. We're kind of unpacking the association between SES and school readiness. There is an association, a predictive association, and we try to understand the family processes that may partly explain the association between SES and school readiness. And we've showed that it's not surprising for most of you that exposition to reading leads to expressive vocabulary that then predicts to school readiness. So we're in a position to identify parental practices that could be helped within families so that we could raise social readiness. So this is, I think, this is highly suggestive of the fact that prevention should start strong in early childhood before problems they get entrenched and before you have cascading effects. So at this point, I would like to move on and start discussing the value of longitudinal research for testing, evaluating programs of interventions. And the case in point is the Quebec subsidized low-cost childcare, for which we had information embedded in the LDEC, luckily. Just to give you a brief update of the milestone in the establishment of the Quebec subsidized low-cost childcare system. The program was established in 1997 by the creation of the Ministère de la Famille et de l'Enfance, and progressively implemented between 1997 and 2000. So places in daycare were open. The initial contribution, so it's really a highly subsidized, low-cost system. At the start, the families had to pay $5 per child, and it's not only in garderies, somewhere where they keep care of the kids, but it's also the idea was also to have a curriculum that was centered on play, a systematic curriculum, and aim at multiple components of development. In 2004, the parent contribution was raised to $7 a day. And in 2006, there was another layer of programming that was added, new universal parental leave programs, with being more accessible, flexible, generous. We can have 1 year of parental leave when we have a newborn in Quebec. In 2012, there were about a little more than 200,000 spaces in regulated childcare, likely more these days, probably around 240, would you say? 240,000 places. And in 2015, there was a highly disputed raise, parental contribution, raised to a maximum of $20 a day, but adjusted to income. So it remains to be seen if this will have an impact in the use of daycare in the coming years. This is just to give you an idea of where the LDEC stands, the longitudinal study stands in relation to the implementation of this new system. So what you have here are the children of LDEC, the 2,000 kids or so, that were followed from 5 months to 5 years in 2003 as they entered daycare. So we got the information and were able to see that there was a big shift in the use of daycare just after the implementation of the program, from 13% to 56%. So really, the new program was really a success, and it still grew just until, well, at least we have the data up to 2003, where 72% of the children of LDEC attended one or the other of daycare, the type of daycare. The other important point is that starting in 2.5 years, there is a systematic increase in the use of CPF facilities, which is our center-based daycare, presumed to be of high quality. So there's really the families of Quebec really bought in the new system, the new program. This is data for Montreal from a survey that was done in 2012, where you see the same trend. Starting at age 1, there is a systematic increase in the use of center-based daycare. Now, maybe some of you have heard about this big study that was publicized. I would say published because the study is not published yet. Publicized about a year ago, that I think really made the point through a series of cross-sectional analysis that the children of Quebec were doing had more difficult times socially and academically since the introduction of the programs. Now, I would like to speak more generally about the challenge of evaluating a universal childcare program. This is a complex endeavor. If the program is a small program that you try to evaluate in a restricted sample, you would like to use a randomized experiment to test it more decisively. Now, this is, of course, not possible, so we use different forms, other types of what we call quasi-experimental design to test this. So I think that's in the spirit of this that the three economists tried to just to see whether the implementation of the program had an impact. And they found increased non-cognitive problems, comparing Quebec children, the cohorts that were exposed, so to speak, to the program, to non-Quebec children. So they had more anxiety, aggression, hyperactivity, crime, but this is maybe really borderline in terms of result, especially for boys. So the problem with this, this is an interesting study, by the way. It's well designed. The problem is that it doesn't really speak about the use of daycare. It speaks about the state of, and we can discuss this, about the state of social emotional development among children of the province at the time where the system, the program was implemented. So it doesn't really address the issue of whether attending the program has an impact or not. So the big issue, the big caveat of this study was that they use population level indicators, looking at children eligible for childcare, not those who went. So that's one of the problems. They were not in a position to evaluate variation in the use of daycare, which makes some difference, as you will see. So this is not the route we took. we did it differently using LDEC. And we were luckily enough, the start of LDEC coincided with the start of the program, the new daycare program in Quebec. So we borrowed some of the questions that were used in LSCY, the big Canadian study at the time, and we used these questions to get information from mother ratings on exposure, whether or not the child went, when, at what age did the child went to daycare, and the type of daycare. So that we could, using that information, connect this information, the use of daycare and the type of daycare used, to outcomes, cognitive assessment, but also social emotional assessment later on. So that's what we did. The first study was, well, not the first study, one of the first study was actually, I say we, but the lead researcher on this is really Sylvana Côté, who, with her students, really masterminded the analysis. So I have to give credentials to Sylvana for doing this. But it's really a collective effort, too. This is the first result where we looked at school readiness measured by really objective measures, test of vocabulary, a general measure of readiness, it's called the Lollipop Scale, a test of reading, test of math. And what we find, these are effect sizes showed here. Essentially, the difference between those who went to daycare, formal daycare in this case, and those who stayed under parental, who stayed with their parents. So there was a significant effect of daycare on vocabulary, readiness, and reading, controlling for a bunch of factors that may explain why you would have such a difference. So it's really under conditions of optimal control, given the information we had in LDEC, that was the first finding showing that attending formal daycare was associated longitudinally with better, higher school readiness scores, which is interesting. But the most interesting point is that it's not a general finding. It's a finding for low SES children. Not low SES, but low educated children from low educated family. So it's a nested effect that we find. It's not a universal effect, but a targeted impact. We more recently went a bit further and tried to model two types of exposure to daycare. Number of hours assessed longitudinally based on mother ratings, mother reports, starting at 5 months to 53 months. And we, again, did the trajectory analysis. So we had 3 groups of kids or families that use daycare, very high intensity, a moderate intensity, and those who mostly didn't use daycare. And you see the numbers are split in 3, about the same percentage of kids. And we also looked at, for those who attended center-based care, we looked at, again, at the intensity, the time when they started using center care and the intensity. So again, we find we were able to identify 3 groups of kids. So three groups of family varying as a function of using or not, the intensity of using center-based care. And we then examine the results of, because we had the information, we followed the kids. The children, all children in LDEC were assessed at the end of 6th grade by the provincial exams. So every children in Quebec undergo the exams at the end of primary school. So we had the data. So we looked at whether or not, depending on the use of daycare, the results at the end of primary school, the results of the government exams, if some children were more successful than others. And we found, again, an interaction effect in the sense that attending daycare, whether with intensity or not, and attending center-based daycare, more or less, did not change much for children of from adequate SES background. But again, we find a nested effect for children of low SES. And it's especially striking if you look at attending CPE, the center-based daycare, where we find that, is it here? Yeah, this here. In writing, in mathematics, and somewhat in reading, there's really the children who attended CPE to a great extent, they really catch up. Children of low SES, they really catch up with the other children of more adequate SES. So I think this is very telling. And more so, and the other thing that I want to add is that this is controlling for a bunch of factors that may influence selection. We know that families who send their children to daycare are not, they will send their children on the basis of some characteristics. The families that send their children to daycare are not the same as those who don't send their children to daycare. So we had information we could control for this, but controlling for this and controlling for the effects that we already had in school readiness, we still find a positive impact in terms of school achievement. So I think that's a very important result. I think that's very telling about the value of attending daycare and especially of attending quality daycare or CPE, center-based care. This is a study that we did a few years ago where we looked at aggression, the probability of being on a high aggressive trajectory in preschool, where we found that attending daycare, especially early on, protect from being on that aggressive trajectory. So this seems to be, again, for low SES or low educated background, children of low educated background, there seems to be, again, an impact. Again, nested. It's not a general impact, but more a localized impact for children or family more in need. This is more recent. We're still examining, in terms of behavior, the changes associated with attending daycare. So these are very general results. We haven't examined whether or not it varies as a function of income or SES. But it's interesting to look at the trajectory of behavior in primary school because we've systematically collected information. This is based on teacher ratings. And we find differences between children who attended daycare and those who didn't on specific outcomes. On shyness and social withdrawal. Not surprisingly, attending daycare at school entry seems to be translated in less shyness and less social withdrawal, controlling again for a bunch of factors that could explain alternatively the results. We find some more behavior problems in terms of opposition and aggression at school entry, but these early differences fades. So those who attended daycare tend to be more aggressive and tend to be more opposite, or seen as, because that's teacher rating, as aggressive and show opposition in first grade, but then after the difference disappear. So we're still playing with this data. I think that's interesting. That's a general effect. It's not having to do with a low SES. So the summary of findings from QLSCD for the moment, I would say that we find a protective effect of childcare for children from low education background, mainly cognitive school readiness and achievement. Benefit seems to be more important for formal daycare, especially center-based. And these benefits extend well into grade school. For early physical aggression, we have the same pattern, but more if childcare began early, possibly due to the fact that they had a reduced exposure to family risk or increased exposure to quality early learning experiences very early on. And that's very early, that's in the first year of life. We also, for other social behaviors, have general benefits for prevention of shyness, symptoms, and social withdrawal that tend to diminishes over time. But also we have maybe negative effect, but non-lasting, especially only in grade 1, on opposition and aggression. Of course, there's no perfect study. This is still correlational evidence. It's not experimental. We've tried to, as much as possible, to control for selection effects, selection biases that are huge in those kinds of studies by having all information that was correlated to the fact that the family would send their children to daycare. So we have a bunch of predictors of that we could control statistically for. So that's good, but we're never sure that we had control for everything. It's based on mother ratings. And we would have liked to have much more quality data than quantity. Essentially what we did was to assess attending daycare, the intensity, the frequency and the type of daycare, but we haven't looked into what was happening in actual daycare, in the actual daycare establishment. So the real policy, or the take-home message from this, I think, is the fact that universal programs may have targeted benefits. So that's with the preliminary take-home message from the studies that we did. So I'd like maybe address a few points to finish my talk. I think it raises the question of how should we provide ECD services to population. The longitudinal studies show that, and there's a bunch of them, both universal and targeted interventions may have sustained positive impact. But both are limited from a population health approach. The limitation of a targeted approach is that, as we've seen, there are many risk factors to any developmental problem. So when you target, you need to target on specific factors and leaving aside other risk factors. So it's really a problem targeting. If you don't have a simple determinant, you target, but you target for only one part of the population. And the way to illustrate this is a slide that Clyde Hertzman, that I borrowed from the late Clyde Hertzman a few years ago, showing that we need universal programs because if on the average disadvantaged children, shown in red here, have poorer incomes, most vulnerable children on many aspects are in the middle class. So by targeting, if you target on socioeconomic status, you leave aside many children who may need services and could benefit from services. Universal approach, well, there are problems too. Universal interventions are not accessed universally. And I really like this slide taken from the early years study where they compare Ontario and Quebec on the basis that was before K4 in the implementation of the kindergarten in Ontario. And where you see that the use of ECD services is much higher in the dark bar in Quebec than in Ontario. That was before, so that was 2008, 2009. But as you add more services, there's a gradient that is being established, a gradient of use, and that's something that we should be thinking about and providing means to diminish. This is more recent. This is a survey that we did in 2015 in Quebec, where we have the same gradient. Not as dramatic, but still the use of daycare, home care, or non-$7 childcare versus $7 childcare. You see the gradient of use of the type of daycare or not using the daycare system as a function of income. So it's really persistent. Because we had the information in LDEC, we could document the different determinants or factors that are related to child care access and use. No surprise, maternal education, maternal unemployment, the number of siblings, the fact that the mother was young, childbearing, and more subtle differences on home simulation. We had a measure of the home, so we could compare the quality of home simulation using that scale. And again, home simulation, the family where home simulation was higher tended to send their children to daycare. And maternal reprotection, which theoretically would make sense too. So there's, again, there are factors that determines if a mother or father or a parent would send their children to daycare. We could see them as barriers to use. I'm not sure we can get to a point where the use of daycare will be spread uniformly in any territory, jurisdiction, but at least there are some that can be worked at, given the fact that, as I showed, it's a universal program will have a targeted impact. An answer, of course, is probably you are all familiar with the notion of proportional universalism. So universal access at a scale and intensity that addresses barriers at a very level. So we really need a universal system, but a universal system is not enough. We need to work at access more, especially for those more vulnerable populations. Just to, how much time do I have? I'm good? Okay, I'm just finished. I just would like to suggest a few ideas or positioning where I stand in terms of what we should be moving in terms of an integrated agenda for a sustainable ECD services and policy. I think we need a model of ECD service delivery. We should promote this model of a public investment proactively aimed at proportional universalism. And I think it makes the perfect sense in terms of the science, for the reach out, for the fairness, and the political sustainability. The advantage of having a universal system is that everyone can be served. So I think that's important politically. Stronger emphasis on children less than 3 years. You've seen these early trajectories. They are being established very early, so we need to intervene early. So daycare or childcare can provide services for this. We need strong horizontal and vertical integration of care and education. So we need to see that as a longitudinal investment. And of course, we need to get more attention to quality and obviously evaluation of the services. We also need an integrated information system that will make it more intelligent in the sense that it will feed back information about how the system and the children are doing in any jurisdiction. So I hope I've convinced you of the importance of having longitudinal studies that can document development and help us understand the processes of development. These longitudinal studies should start very early. we need a system of developmental surveillance to have a general idea of how the kids are doing in any jurisdiction. We have to build tools for this. Now, there's a limit about this. I'm not sure that we can start very early developmental surveillance, but the idea is to have maybe an early assessment, but also more a longitudinal system so we can trace the development of kids over time. We need systematic evaluation of ECD prevention programs, services, and policy, including the implementation of services, which is le parent pauvre of kind of a neglected aspect, rarely or not often evaluated properly. And we need a system where we have information about the delivery of ECD services in population and across population. And we also, and I will conclude with this, we need to synthesis tools so that we can disseminate the best ECD knowledge in the population for parents, educators, of course, professionals, but also policymakers. And I'm involved in the Encyclopedia on Early Childhood Development, so many of you may have learned about it. So it's a nice tool that is being used nationally and internationally, and in which we try to curtail the information for different targets of people. So targets parents, but also policymakers. I will leave you with just a citation of Jean-Jacques Rousseau that I borrowed from my friend Richard Tremblay. I think that speaks very well to the importance of play. And Jean-Jacques Rousseau is speaking in Émile. You are worried about seeing him spend his early years in doing nothing. What? Is it nothing to be happy? Nothing to skip, play, and run around all day long? Never in his life will he be so busy again. I think we should keep that in mind. So I'll leave you with this, and thank you.
Thanks. Hello? Hello? Thanks, Michel, for just a stunning talk, a really lovely integration of those longitudinal studies and really what we need to do about the outcomes for kids. So I think we've got time for just one or two questions. Who'd like to start before we have lunch?
People
Harry.
Thank you, Michelle. Two questions, if you don't mind. So you're noting that there were benefits for low-income kids within Quebec's childcare centers, which are university available. Would you see those same do you think you would see those same sorts of impacts if the program was targeted to low-income children only? So question number one. Number two, as you talk about childcare centers, but there are different sorts of childcare centers in Quebec, did you find a difference in terms of who was offering the childcare centers in terms of the outcomes?
Who is offering?
Well, whether or not the operator was a CPA as opposed to a private operator as opposed to a family daycare.
We haven't looked at that, so we don't have the data in terms of the quality of data we've collected. So we're not in position to analyze this. But for the first question, the answer is likely. I mean, if you target and you put all the emphasis, the point is not that targeting is not good. It's not enough. So I think that's why we need to have a universal system, because if you target only on socioeconomic status or income or education, you leave aside a bunch of factors that are predictive of negative outcomes, the risk factors. So the issue of targeting is targeting on what? And then there's the issue of the political sustainability. You could argue, well, it's good to have targeted, it's a better investment. People would argue that. You get more return on your buck for that. Perhaps, but at the same time, you have vulnerable kids likely elsewhere, not in OSCS environment, that don't get services. And the parent is, you could say, well, why? It's a question of political sustainability. I think it's probably more easier to sell a universal system because all can benefit from it, and then work at the gaps in terms of access.
Anyone else? Where's the...
One last question.
Given that the childcare programs in Quebec are accessible in terms of affordability, are you seeing the disadvantaged families access those programs in the numbers that we would like to see? Do you have any data on that?
That was part of one of the slides. Yes, they don't go to good quality daycare. There was some surveys done quite a while ago. I don't know if it has been done recently, but showing that access to daycare, use of CPE, the best quality ones, was stratified as a function of income. And so, and also there was a study, it's a one-shot study, it's not a longitudinal study, on quality, where they evaluated the quality. And access to quality daycare was also stratified as a function of income. So there were less quality daycare in environments where low SES families were. And when they went to daycare, they went to daycare of less quality. So that was 10 years ago. I don't know if there were new surveys done more recently. I'm not aware of that. But I would bet it's stayed the same. Although some have made efforts, I know the Fondation Chagnon, for instance, the Chagnon Foundation put a lot of effort to open quality daycare in low SES environment too. So that's been happening for the last 10 years. Maybe that changed the picture a bit. But that's by the way, an example of proportionate universalism. When you have a foundation who puts a lot of money to try to equalize access, that's a way to, it's a good example of what we mean by proportionate universalism.
Merci, Michel. Thank you very much.
Thank you.